Welcome to Rural Health Pulse. I'm Jim Kinnear, Chief Human Resources Officer at the Indiana Regional Medical Center. In this series, we focus on ideas and stories impacting the health of our region and explore the programs and initiatives designed to improve healthcare and wellness. This podcast is a collaborative effort of IRMC and Indiana University of Pennsylvania. In this episode, our topic is the Pennsylvania Rural Health Model. The Pennsylvania Rural Health Model is an initiative in care transformation to increase access to high-quality care while reducing hospital expenditures and healthcare costs. Our guest today is Ms. Wendy Haislip, the Chief Nursing Officer at Indiana Regional Medical Center. So to get started, would you take a few minutes and introduce yourself and tell us a little bit about your role at IRMC?
Yes, good afternoon. My name is Wendy Haislip, and I am the Chief Nursing Officer at Indiana Regional Medical Center. I joined the organization in October of 2019, so it'll be 3 years this Friday to be exact. It's been a great journey, an exciting, rewarding, and challenging journey, but very proud to be part of the organization and be here with you here today.
Well, we're excited to have you here, Wendy. I know you have many roles at IRMC, but one of the current roles that you're very involved with is something called the Pennsylvania Rural Health Model. And could you tell us a little bit more about that?
Certainly. So we are one of 18 hospitals that are participating in the Pennsylvania Rural Health Model. And it is actually a model that's open to both critical access hospitals and acute care hospitals, of which that is what we are at IRMC. In rural Pennsylvania, and participating payers, including Medicare, Medicaid, and certain commercial plans, are committed to attaining participation and allowing the opportunity for rural hospitals to help transform the care that they deliver, providing top quality, and for many hospitals in the rural Pennsylvania area. We also look at our budgets. There's a global budget piece to this that helps focus on value, and the participating hospitals prepare a transformation plan outlining the proposed care delivery transformation, which must be approved by CMS.
As you describe that, I heard two key things that we hear a lot of times in healthcare: cost and quality. So one of the things I understand is for rural hospitals in particular, it can be a challenge to have financial stability. How does this budgeting component of the rural health model help with that?
There's actually funds that's accessible through CMS, upwards to $25 million in funding to help Pennsylvania hospitals implement this model under this proposed plan. This is a plan that was put into place back in 2019 with the intention that it runs through 2024 and that there is evidence to support that this model works and can continue long after that. So there's several performance periods that look at the budget and the payer piece to it. And then where I come in and help with the team is really looking at how do we deliver care differently. So there's targets around not only the financial, but population health outcomes, which provides patients in the community access to quality care and targets that are identified by the state.
As you mentioned how we deliver care differently, can you share a couple examples?
Certainly. So the goals that we established for IRMC were based off of the community needs assessment that the hospital conducted here in Indiana County. And those goals consist of behavioral outreach, which is a span of over 2 to 3 years. There's also one around substance abuse and one around readmission reduction, as well as our fourth goal, which is providing a swing bed service in the community. I'll give you an example of the swing bed. We participated in that through the state during the emergency waiver, and it allowed us to transition an individual from an acute bed to a swing bed, providing very similar, if not identical, care that they would receive in a nursing home. Based on the challenges that we encountered in the community during the pandemic, with shortages on nursing home beds, shortages on staff in that arena as well as our own, it allowed us to still provide that very valuable service to our patients here in the hospital and in the community, so there's no gap in care.
So one of the things it sounds like with the swing bed is just that flexibility of not having to worry about how care is going to be paid for, but being able to provide that care on an ongoing basis there in the hospital setting.
That is correct.
So with some of the other initiatives you mentioned, could you elaborate a little bit more? In particular, we hear a lot about mental health issues in a rural population and substance abuse issues. How does the rural health plan address some of those challenges?
What that does is it allows us to bring a cohort of individuals not only in our own community, but also surrounding counties. So we have access to the other hospitals that participate in this program. It allows us to break down those silos and work collaboratively, work with our payers and our partners here locally, but also extend it at further reach to help be able to meet some of those needs. We know that from a behavioral health standpoint, from the state part, there's a lack of beds. So this allows us to really, extend the olive branch with other partners in surrounding areas and problem solve together and figure out how can we tackle this, knowing that we need to work in tandem with the resources that we have, but also we have these funds that we now have access to that allows us to look at new programs, put into place maybe new roles or resources to help us accomplish what we all want at the end of the day, and that's a healthy community.
So to describe that, just get the sense that this rural health model helps to bring rural hospitals together that are facing common challenges and to share information and how they're addressing those.
Yeah, it's pretty unique to see that. We have monthly meetings, then we have quarterly updated meetings where we get into a little more detail around the transformation plans. As they look at the future state of this model, they certainly have asked for our input from the participating hospitals as to what we would like to see the future state in the vision for this model in the future. And one of the things we've talked about is focusing more on a collective transformation plan versus isolated transformation plans because every one of the 17 other hospitals has their own plan. So going into the future, do we have one collective transformation plan that we all are participating in together to really help strengthen our power in numbers, so to speak?
And I understand as part of this model, you also have a person who serves in the role of a coach to help the organization with its plan. Could you tell me a little bit more about that process and how it works?
Yeah, so there are members that are part of the PA Rural Health team. Some are providers, some are nurses by trade, so they absolutely have a healthcare background. They're assigned to individual hospitals, and they help you identify how to build your transformation plan. Again, we used the basis to our community needs assessment to look at where were the gaps within the county and how could we build on that. And then they also help us identify what tactics. So under each goal, there's anywhere from 10 to 12 tactics that we have implemented that help support the overarching goal. And then we have team members that are assigned to those tactics to make sure that we're meeting the needs and getting the work done at the end of the day.
What would you say was the main reason why IRMC decided to participate in this particular model?
Well, I think most people see, and hopefully it's demonstrated every day, how committed we are to the community here in Indiana County. And this was an opportunity for us to look at partnering with other entities within the healthcare system, whether it's, CMS, this behavioral health group that we're partnered with, or whether it's other hospitals in surrounding areas who are rural and face the same challenges that we do. We need each other more than ever in the healthcare setting, and so I think it's just a great way to extend and help each other out, and so that we're delivering high, top quality care.
Wendy, can you tell us a little bit about the Pennsylvania Rural Health Model? What's the state agency or organization that is responsible for this particular initiative?
Yeah, so the governing body behind all this is CMS, and it's actually CMMI, which is Centers for Medicare and Medicaid Innovations. That's the body who's actually driving this initiative, and they want this to be successful because this not only helps to increase collaboration, but it also looks at ways to decrease cost in the healthcare setting and help remove waste that's not serving the hospitals and then serving the community that we all take care of.
Thus far in IRMC's participation, have there been any early wins or successes that you'd like to share?
Yeah, I think so. I mean, it's been great to collaborate with other hospitals. I've certainly built some connections with other leaders within this 18 cohort of hospitals that participate. We've certainly been able to maintain the swing bed designation up to this point with the help of the PA Rural Health Model. We've also been able to impact some readmissions around CHF and heart disease. So that's been a good win for us. And I see nothing but great things continuing as this program unfolds.
Well, that's great. Exciting to hear that early progress. Earlier in our conversation, you mentioned that you've been at IRMC for about 3 years. What's the biggest differences have you seen coming to a hospital in rural Pennsylvania from your previous employer?
I think in the current state, especially with a pandemic, resources is always a challenge. Not that resources was, you know, plentiful where I previously was employed, but I think in this setting, I really like the rural health environment because it allows you to really build relationships with people within an organization. Sometimes your larger organizations, it's hard to get to know people on a personal basis, understand their role and how that impacts the organization. And I really enjoy who I work with. I enjoy the team that I have. They're a great group of individuals, so I feel like I get to know them personally. And then there's a lot of connections within the community. Most people that work at the hospital have, or that come in as patients, they know somebody within the hospital. Everybody knows someone, whether they went to school together or their kids went to school together. So it really is a family atmosphere, and that's certainly one of the draws and one of the reasons why I enjoy working at IRMC and plan to stay.
Well, that's great. And it's great to hear that sense of community in the small rural hospital. You also mentioned resources earlier. So as we think about rural healthcare, we know staffing challenges are a concern in almost every sector, and certainly in other areas of healthcare. I can imagine being in a rural setting creates some additional challenges with staffing. Can you tell us how IRMC is navigating this?
Certainly. Staffing has always been a challenge in healthcare arena, but I think the pandemic really brought it to the forefront. And that's in every hospital. This is absolutely a national issue. It's not just specific to IRMC. But I'm very proud of the efforts and the team effort that is behind recruitment and retention within the hospital. We have a recruitment and retention committee, which is made up of multiple individuals within the organization. We've looked at referral bonuses for our own internal employees, that if they refer someone to work to the come work in the organization, there's a financial incentive or bonus for that. We have sign-on bonuses for potential new hires. We also have offered retention bonuses for our own internal staff. We have weekend programs that we put into place, which allows a nurse to essentially have the best of both worlds. If they have small children and maybe daycare is a challenge, or maybe they have children in school and they'd like to be there to participate in school activities or put them on or get them off the bus, the weekend program allows them that benefit that they're home through the week and then they work on the weekends where hopefully they potentially have a spouse or family members that can help take care of their children on the weekend. So that's a really nice incentive to help. One of the other things that I'm very proud of is we implemented in September a new grad nurse residency program. That was something I had experience with. A lot of great success with these types of programs. We actually conducted a few surveys with college students to try to get a sense of what were they looking for in an employer. And this was one of them that bubbled up to the top. That first year as a new grad is pretty scary and challenging as they're learning to navigate the world of being a nurse. So this cohort allows them to build a relationship with their instructor, who's part of IRMC, but also their peers that are in the program. They do hands-on training. They have classroom training, and it's a year-long residency program. When they graduate at the end, they'll present an evidence-based project that they worked on that's maybe something that they want to see implemented on their department or throughout the rest of the hospital. And our goal is to continue to do this on a yearly basis so that we can draw new grads in. And, we get great feedback when we've brought staff in, and I think this is just another way to strengthen our ties to the community and the colleges. We have used agency. That's what we've seen a lot of other hospitals do as well as we navigate the challenges of healthcare. But we've certainly had an abundance of recruitment fairs. We have our nurse recruiter that visited local colleges and shares what we're working on. We're on the journey to Pathways to Excellence, which is a designation for the hospital that represents that nurses deliver high-quality, patient-centered care. So we want that designation. It's an exciting one to have. It's an honor to have that designation. And so a lot of the groundwork and activities and initiatives that we're focused on is really about laying the groundwork for that journey.
As you describe some of that work that's being done, it's interesting to think. I think a lot of people would think of rural healthcare maybe being a little bit less progressive than other areas of the country. But I'm hearing words like transformation, innovation, excellence, a lot of work happening in rural hospitals to ensure high quality care and also attracting high quality staff as well.
Agreed. Yeah, I think that's a misnomer that's out there because I certainly see great innovation and a lot of creativity that comes out of the staff at IRMC. It's impressed me and still impresses me to this day. One of the things that nursing embarked on was creating a 3-year strategic plan, which supports the organization's strategic plan, but it includes frontline nurses. They built that strategic plan. They helped identify where we wanted to put our focus, what was important to them as an employee, what was important to the organization from a quality and a patient experience standpoint. So they really are the owners and the drivers behind those initiatives. We have unit-based councils we're forming. We have house-wide councils we're forming, staff meetings where we're seeing a lot of engagement and enthusiasm around the work that we're doing. It puts a spring in my step every time I hear the updates and I see the good work that's going on. It truly is impressive, and it absolutely is a great place to work, and I'm very proud to be the chief nurse.
Wow. And that's a great note, I think, to end on. I just want to thank you so much for your time today and coming and sharing all the great work that's being done.
It was my pleasure. Thank you.
The Pennsylvania Rural Health Model is an effort to improve the financial viability of rural Pennsylvania hospitals while also improving healthcare outcomes and maintaining access to high-quality care. Rural Health Pulse is a collaborative effort of the Indiana Regional Medical Center, Indiana University of Pennsylvania, and the Indiana community. It is produced by Chris Korn from IUP's Division of University Advancement and recorded by the IUP Communications Media. I'm Jim Kinnear. Thank you for listening, and be sure to watch for future episodes of Rural Health Pulse.